In this video, we're going to cover the veins of the body, with the focus mainly on the systemic veins. And veins are defined as those vessels that transports blood towards the heart. And when that blood gets transported towards the heart, it goes both to the right atrium and the left atrium. So in the right atrium, that blood that enters the heart is deoxygenated blood, and there are three entries into the right atrium. One comes from the superior vena cava, the second is the inferior vena cava, and then the third entry comes from the venous portion of the coronary circulation. With respect to the left atrium, there's really just one entry, and that's oxygenated blood coming in through the pulmonary veins that are returning back to the heart from the lungs. In terms of the systemic circulation, systemic veins are superficial as opposed to arteries, which are located much deeper. And in some parts of the body, there are multi-vein bundles that are just simply referred to as individually as a venous plexus. Although veins are generally superficial, we do have some deep veins, and those deep veins do follow the path of what are called companion arteries and are named according to those companion arteries. It's the superficial veins, as you can see in this picture right here, that are visible and subcutaneous, so just underneath the skin. So one example is the median vein of the forearm, which is quite visible, in addition to a number of the other veins in the forearm. So we begin here with the veins of the head and neck, and we'll start on the left-hand side, and we see that we have essentially deoxygenated blood draining from tissues, entering the venous circulation, and will collect into what's called the transverse sinus, which then continues, and the name changes into what's called the sigmoid sinus. So we have this fairly tight turn, if you will, in this vein that is draining from the tissues of the brain. And then that blood will collect and drain into the internal jugular vein, and this flow is going to be headed in an inferior manner. When it comes to the superficial portions of the head and neck, face, scalp, and other related tissues around the eyes, the internal jugular vein, as you can see here as a reminder, will be draining blood from the brain. But with respect to this other tissue will drain its deoxygenated blood through the external jugular vein. And as you can see here, one other major vessel that also drains from tissues of the tissue in the spinal cord is the vertebral vein. So this is all blood that collects and will drain into the brachiocephalic vein that will continue in towards the right atrium. When we take a look at the upper extremity, we'll start on the distal end of the upper extremity. So here you see a number of veins of the fingers and the palm, and that blood will drain into the radial vein. We have the most lateral position vein called the cephalic vein, and the vein on the most medial side of the forearm is the ulnar vein. The basilic vein, also located on the medial side of the forearm, helps to drain that tissue of the forearm, as well as collecting it from the hand and fingers. The median vein of the forearm will also drain from the tissues of the forearm, and the median cubital vein is this vein that is quite superficial and observable on as a subcutaneous vein of the anterior elbow. As we continue to move proximal along the arm, the cephalic vein, you can see here, continues as the cephalic vein all the way up. Its name does not change until it eventually will get up to the clavicle region. The brachial vein, as you can see here, will drain the tissues of the upper arm, and this will merge and form the axillary vein that will then merge with the cephalic vein, forming the right subclavian vein. So we have the vein passing underneath the clavicle, and likewise we have the same vein on the left hand side passing underneath the clavicle, called the left subclavian vein. The names of these vessels will change into the brachiocephalic veins. Once again, we have one on the right and the left, and these two veins will merge, and all that blood, in addition to the blood draining from the head and neck region, will move into the superior vena cava, and this will drain this blood into the right atrium. We take a look at a number of veins here. I'm going to put some red boxes around the ones that I'll make note of. If we start here on the very bottom on the right hand side, we see that the internal iliac vein will drain blood from the pelvic region, and the external iliac vein will see blood returning from the lower extremity, and the merging of the internal iliac vein will along with the external iliac will form the common iliac vein, and this is blood flow that's moving in the opposite direction to the like-named arteries that are transporting the oxygenated blood. The right gonadal vein drains deoxygenated blood from reproductive organs. The right supra, meaning on top of the kidney, which is referring to the adrenal gland, when we have a right and a left suprarenal vein that drains blood from the adrenal gland into the inferior vena cava. Likewise, renal veins will return blood from both kidneys. The hepatic veins, although it's not pictured here, the hepatic veins will be draining blood from the liver, and that's blood that returns back to the general circulation. And all of that blood will collect into the central inferior vena cava, that once again this blood flow will continue to move in a superior direction and end up in the right atrium. A unique portion of the circulatory system is the hepatic portal system. Hepatic referring to the liver, and the portal system is defined as a portion of the cardiovascular system that has two in-series capillary beds. And we'll start here on the left-hand side. So as we have arterial blood that is coursing through the body, a portion of that, about approximately 20% of that blood under resting conditions and that can go up after a meal, will go to the digestive system, and particularly as it relates to the small intestine, that is the location where we absorb the molecules or nutrients in the food that we consume. So this artery will branch into arterioles, into metarterioles, and eventually into these really small capillaries, which is the site of molecule exchange with tissues. So this is the first capillary bed of our hepatic portal system. So at this point, we see the oxygen will move out of the blood and will support the cells of the digestive system, while the nutrients inside the digestive system moves into this first layer of capillaries in that first capillary bed. Now, leaving the digestive system, these blood vessels will merge into the hepatic portal vein, and the hepatic portal vein, before returning to the general circulation, will make a pass through the liver. And at this point, the hepatic portal vein will branch into a second capillary bed. And at that point, the liver will absorb not all of the nutrients, but a number of those nutrients that were initially absorbed into the cardiovascular system from the digestive system. And one example is that the liver will take glucose molecules from the blood and put those molecules into storage in that tissue, and then the metabolic end products of liver cells will then move into the second capillary bed that will then return to the general circulation through the hepatic vein. So the main point here to make a note of is that the hepatic portal vein is the vein in between the two capillary beds. The hepatic vein is the last vein that leaves this entire portal system. Moving on to the lower extremity here, starting on the right hand side, this is a posterior view of the lower leg and the plantar side of the foot. And just like the hand, we see a network of veins that will drain blood from the toes, the tissues of the toes, as well as the foot. And on the plantar posterior side, that blood drains into the posterior tibial vein. Other blood will drain into the small saphenous vein, located roughly along the midshaft of the calf muscle. The fibular vein along the lateral portion of the leg will drain blood from the lateral tissue of the lower leg. Partially obscured here is the anterior tibial vein that we'll see much clearer here on the left hand side, and these vessels will merge into the popliteal vein, with the exception of this other vein here that I'll illustrate here shortly. So the popliteal vein once again passes through the posterior side of the knee and will continue to move in a superior direction towards the heart. The anterior side of the leg, as we can see here, we have the anterior tibial vein that will drain tissue from the dorsum of the foot and the anterior portion of the lower leg. Once again, as we saw on the right hand side, we have the fibular vein draining from the lateral portion of the leg. The silhouette figure here illustrates the popliteal vein that we see coursing through the posterior side of the knee joint, and the great saphenous vein will collect that deoxygenated blood along the medial leg, and that's what's illustrated here. The label will show up here in a moment. The femoral vein will continue to drain blood from the tissue of the thigh, and as illustrated in an earlier slide, the internal iliac vein will drain deoxygenated blood from tissues in the pelvic region. The femoral vein continues and it will continue as the external iliac vein, as the great saphenous vein will merge with that external iliac vein, and then once the internal iliac branches and merges with the common iliac, or with the external iliac, it forms the common iliac vein. And as illustrated on the left hand side, we see the great saphenous vein that is involved in draining tissue from the medial side of the leg. So this ends our third and final video of part 2 of the cardiovascular system.